In this video, we're going to go over knee subluxation or dislocation to the lateral aspect or to the outside of the knee joint. Now, this is a very common condition that happens with people, especially teenage females. I've treated a lot of teenage females over my years of experience that have this where it feels like either the kneecap wants to slide to the outside, can cause some pain, or they go down into a deep squat, or maybe they're dancing or cheering or playing softball or whatever, and the kneecap actually dislocates what's called laterally or to the outside. And so this is a right knee here. And so what basically is going to happen is that kneecap is going to slide to the outside of the groove. And the bottom of the kneecap or the patella sits inside what's called the trochlear notch or the trochlear groove, and it rides through there. And so there's several theories as to why this happens and why that it tracks laterally or to the outside. And so this video is not to necessarily go over the why, but what are some things that you can do to try to help it at home? Because again, there's a bunch of theories and opinions on why this happens and how to prevent it. So if you're having this happening to you, then I'm just going to show you techniques that you can do at home to try to reduce this occurrence. So the first thing that we're going to do is a combination quad set where I'm going to tighten up my thigh, really try to flatten out my knee joint, a quad set. And then I'm going to combine this at the same time with a straight leg raise. So let me show you the sequence here. So I'm going to tighten up my thigh, I'm pushing down, and then I'm going to bring my leg up just a little bit so that it comes off the mat or the floor or the surface, whatever that I'm on. So that's the sequence. Tighten up the thigh, straighten the knee, pull my toes back and kick up. I'm going to hold it a few seconds and come right back down. Now, initially, if your knee is really painful, you might not be able to do that, hold it for very long or make a very strong contraction. So just do the best you can with it. And then after you got to where the pain was a little better, I would go ahead and start using a leg weight. Now you're going to want to start light because again, with this, you could irritate things a little bit. And I'm okay with my patients increasing their pain some when they're going through their program, but we don't want to exacerbate it so much that then you can't continue, for the rest of the program throughout the rest of the week or the rest of the day. So start with no weight and then progress to a light cuff weight and then so on. One of my favorite exercises when treating the knee are seated knee extensions. I like this exercise because it's been shown in the research to have some of the highest EMG activity within the quadricep. So I have this 4-pound leg weight around my bottom of my leg there, and I'm going to kick it out. And I'm going to hold this 2 to 3 seconds and come back down. Now, if you've seen my other videos, you know that I like to ask my patients to pull their toes and foot back at the top of that movement. I feel like I feel it more in my quad when you do that. Again, that's just my preference. And you kick out, pull back, I'm going to hold it, really tighten everything up, come back down nice, slow, and controlled. And I'll repeat that for 2 to 3 sets of 10 to 12 repetitions, 1 time a day. Now I'm going to perform wall sits and then progress to wall squats. And so I have my feet somewhere around 7 or 8 inches away from the wall. As far as placement, how wide, just whatever feels comfortable and stable to you. And all that I'm going to do is I'm going to start with a high wall sit first, bend my knees just a little bit, come down, and I'm going to hold this somewhere between maybe 10 to 15 seconds and then come right back up. And then I'm going to go right back down, hold it, and then come right back up. I would progress to going lower and try to hold that at a lower position, same way, and then come right back up. And then eventually progress that to just regular squats where I'm sliding up and down the wall, completing 2 to 3 sets of 10 to 12 repetitions. Now, if you don't have a smooth surface that you can get against with this, you can take one of these balls, lean in, make sure this is nice and stable. You don't want it to come out from under you and go just like that, down and up. Again, 2 to 3 sets of 10 to 12 repetitions, 1 time a day. This exercise I call step ups and step downs. And so I have my step here right beside my leg. As far as how high do you need the step to be, you can start with it really small and progress to a taller step. And so we're going to say this is my right knee that's affected. I'm going to step up, nice, slow, and controlled, and come down slow. Up, nice, slow, and controlled, and come back down. And so that's strength, stability, motor control, and muscle endurance all in one. Again, I would complete somewhere between 1 to 2 sets with that because it is a little strenuous. 10 to 12 repetitions, 1 time a day. My last tip for reducing pain and symptoms in this area as well as occurrence is going to be using either a taping technique to pull the kneecap more center line, a little bit of force to keep it from being pulled so far laterally, or a lot of times I recommend my patients will get a knee brace that has a little buttress pad in it that's going to push against a kneecap to keep it from sliding out so much. Now that's not a cure-all because remember, we want to build strength in the quadricep and motor controllability to try to reduce this from happening, but especially while we're returning to sport or just your general walking mobility, one of those braces, it does really well at giving some pain alleviation as well as confidence that the kneecap's not going to slide out again. Thanks so much for watching this video. I hope this helps reduce your knee pain and occurrence of a subluxing or dislocating patella. Thanks so much.